Like, what are the biggest obstacles that you see down there?
They don't have dentists or doctors in the islands around.
So many dentists, our identity is linked to dentistry.
We said, wow, we can actually make a change with our hands. How powerful is that?
What up, everyone? How's it going? Welcome to another episode of Hi, I'm Doctor. And this week we have a special guest, Sandra Martin, Dr. Sandra Martin, all the way from the Bahamas, but she originally practices in Europe, but she's in the Bahamas right now. Welcome to the show. How you doing?
Thank you, guys. Thanks for having me.
Yeah.
Amazing, amazing. Just
What are you,
landed here, so
what are you doing down
leaving
there?
London behind. So we come for a dental mission with Glow Good, which is part of the Levins family foundation, and Let Love Rule from Lenny Kravitz, that he lives most of the year here. So we come every year to help the community, and it's been 7 years now. So this
Oh,
is our
wow.
seventh mission.
Wow. So
Yes.
you've been on every year.
No, I haven't been on every year. I haven't been on every year.
Okay.
But we try to change from the oral point of view, obviously a community, and it's just beautiful to see the evolution of things, right? Going from teeth extraction to now maintenance. So
Oh,
it's,
wow.
yeah, very rewarding.
So you
What
guys
do you
are
mean by
working,
that?
you're in the same community every year? Sorry?
Same community every year. The thing is that there are people from other islands. I don't know if you know a little bit, but when people say Bahamas, they're like, "Oh my God," and they think everyone's rich and famous, and it's not true, unfortunately. So they don't have dentists or doctors in the islands around. They do have in Nassau. So the other islands are left pretty much with no dental care, no health care. So they come every year that they know we're coming, and they take 2, 3 boats to get to us, and they just queue up outside the clinic, and hopefully we're able to see them while we're out here. Yeah.
Isn't it because the Bahamas is just so many, it's like an archipelago. So there's so many different tiny islands. So all their healthcare is dispersed.
Exactly. It's just an existence. That's the thing, right? So which is a shame, but yeah.
But people think Silicon Valley when they think of the
Yeah,
Bahamas.
Yeah.
exactly. But a charity.
Yeah, that's even like I know the Bahamas pretty well. So I was like, even knowing the Bahamas, you were like, I'm in the Bahamas doing charity work. I'm like, does Jeff Bezos need veneers?
Yeah.
Like, what are you
So,
doing in the
Yeah.
Bahamas?
so like what kind of work does your like day to day look like down there? Like what are you doing during the day in the Bahamas?
Obviously, unfortunately, we do a lot of extractions,
Yep.
from children to adults. We do a lot of full dentures, partial dentures. But thanks to Henry Schein, since last year, we brought down printers, digital scans, so it's made our workflow much faster and easier, to be more efficient, right? Because we're seeing on average like 340 patients a day, so that's a lot.
Holy cow.
Um, yeah. So yeah, we try to do as much as we can, and
That's
I think
always
it's evolved a lot. Sorry.
that's always been my dream to bring like because
Yeah.
we do dental missions every year. Like I'm going to Nicaragua in February, and we're like
Nice.
I'm the team leader, and I'm embarrassed to say that I keep it pretty primitive because we often just do extractions and fillings. But I've always tried to get
Yeah.
denturists to come with me, and I'm like, man, just bring your scanner. I'll hook up the scanners. We'll get power to the
Yeah.
printers. But it's easier said than done. Like that's amazing.
It's,
You
I
guys have
mean,
been
it's
able to coordinate that.
it took many years, many
Yeah.
years. Again, this is the seventh mission, and the pandemic, it was like 3 years we couldn't come out here. But it is possible. Obviously, you have a lot of issues. Last year, one of the printers broke, and then
Yeah.
connection issues, like I was telling you guys. And but hey, you do as much as you can, and if you have, you're lucky enough to get it from like a sponsor, and then they send all the blocks. Obviously the colors that they send are not the colors that you want, but there's only so much you can do.
Yeah.
But yeah, my aim, and all of the same as my colleagues, we don't want to come down here and just extract teeth. We're trying to change a culture from the way you eat, what you drink. That's as important as everything else. And that is the most challenging part, trying to change that.
So do you see the same patients kind of year over year, or are they a whole new set of patients?
No, it depends. It depends. Some were left over from last year that we didn't finish the work. again, the technicians we bring, they work, 24/7, because normally we bring down 2 technicians at the time, and they're throwing dentures and partials and oils and stuff, and they're just like looking down and working. But yeah, it's, I mean, last year I saw some patients I had seen the year before, and or they bring their kids, their family, their extended family, but normally we try to accommodate everyone that we haven't seen previously.
So Sandra, what are the biggest challenges that you see? Like, what are the biggest obstacles that you see down there?
Lack of materials,
Yeah.
lack of resources, definitely. And then for me, I study a lot about nutrition, and for me it's the culture, right? I always see, I'm from an island myself, so when I come to an island,
Which one?
I would think Canary Islands. So it's a
Okay.
group of 7 islands just in front of the coast of Morocco, but we belong to Spain. And I'm from an island called Tenerife. And every Canary Island, our main food is fish. So to come down here and see that there's a lot of fish, but people don't fish, and they eat, fried chicken, and everything's
Oh,
very fried. And it is an issue because you guys know it all starts in your mouth, what you put in your mouth. But sometimes when Coca-Cola is as cheap as water, it's, yeah, you have to go backwards. So where does the change start? How can we change this? And that is really important.
So you kind of, before we get started, you talked about your creative side and your love of fashion and design. So why don't you tell the listeners a little bit about the non-dental aspect of your creative side?
I just think, I mean, the dentists, we have to be artists, right? Because we create whatever it is, from a filling to, obviously not extractions, but we create. I do cosmetic dentistry, so I love designing smiles. And you hear me, right? Sorry, I lost you for a second.
No, I hear
Yeah.
you.
So for me, I started when I was very young painting. I'm not a painter, so that's why I have to be careful what I say. But I started designing and customizing T-shirts for my friends, and then I'll do jackets, and I love that side. The same as music, I like writing lyrics, and I love music. Whoever knows me, they're like, yeah.
Sandra, how do
You'll
you
find
get
me at any concert in London.
how do you get the confidence to just jump into designing? I feel like there's a creative spark in so many different people, but no one's willing to take that leap. And here you are, like, man, I'm gonna paint a jacket. Like, I'm gonna make this jacket my own. Where does that come
Just
from?
fearless, right?
Yeah.
Just I'm not scared of anything but inclines. You'll never see me skiing. It's the only sport I love. Sports. The only one I won't do is skiing.
Declines.
Yes, but yeah, you just have to jump in the pool, right? And then you'll see if there's water or there isn't. But yeah, that's why I don't call myself a designer or a painter. I'll just do it. Those
Yeah,
are bigger words. I have friends that are painters, and all my respect to them.
So how about
But yeah, it's just, yeah,
how about
creative.
following the creative journey just for the sake of following it? I find that's pretty hard for me to do without trying to say I'm creating something of use. It's like I feel like I'm more able to justify creating like something that could benefit, I don't know, like my career or like dentistry. It's like I find it hard to just set aside time to do creative acts like write lyrics or paint. Or how do you have the discipline to do that? Because that's also not easy.
For me, I need it. I can't just do one thing. My head is in 20 different things. And I'm the kind of person that if a friend of mine tells me they're about to do a business with, I'm always giving ideas because I like it. It's part of me. So if tomorrow, hopefully not, but if I couldn't be a dentist anymore, I would be fine. I would say, okay, let's explore something else. I don't like to be caged in one thing because I think there's so much you can do, so much you can explore. So of course I love my profession, but there's so many other things that you can actually nurture from and then go back to whatever your profession you have and become better at it, right? If you just box in what you do, at least for me, it's a bit claustrophobic.
Sandra, I absolutely love this
So,
attitude because so many dentists, our identity is linked to dentistry. And here, all I'm hearing is, don't label me. Don't label me. I'm Sandra.
No,
I'm not a
not at
painter. I'm
all.
not a dentist. I'm just me. How did you get on the dental journey though? Like, it seems like you could have gone in a million different directions. Why dentistry? How did you end up here?
Since I was little, I was very obsessed with people's teeth. I would look, some people go like the hands, the eyes, the nose. For me, it was all about teeth. And then I was in school and I was doing theater, musical theater. And I always liked, again, that creative path. And I remember saying to my parents, I think I want to do music production. And they're like, why? Like, how? What are you going to work as? Again, I'm from a small island. So it's like, and then my mom, she made me do, out of everything I wanted to do, she's like, you're going to do a month in whatever you want to do. Do you want to become a doctor? A month in hospital, a month. So I remember I said, let's talk to our dentist. And I walked into his office, and first it was the music and then the way he carried himself. And then I remember this person walking in like this, and she didn't want to smile. And he just did all these anterior fillings, these composite buildups. And all of a sudden she walked out with this big smile. I was like, oh, this guy's a genius, I said, I want to be him,
Yeah.
So that's what, I went back home and I said, I know, I want to be a dentist.
That's
But then I
interesting.
started, and I didn't really enjoy the first year. I remember I was like, what is this physics, chemistry? I want to see teeth. What is this?
Yeah.
Biology. But obviously it's the foundation of things.
Where did you go to school?
In Barcelona.
Oh, wicked.
In Spain,
Okay.
because Canary Islands, we don't have any dental schools. So yeah, my brother was already studying there. My dad said, you both have to go to Barcelona. And then the first challenge is Barcelona they have their own language, which is Catalan, right?
Yeah.
So not only I was going to a city with, that it wasn't my favorite. Then I ended up loving it because it's beautiful. But I wanted to go to Madrid, where all my friends were going to. But then on top of it, I had to learn a language. So challenge after challenge. But it was worth it, of course.
Were a lot of your dental student friends like you in that they had that creative side to them, or were you kind of an odd one?
No, I'm the odd one. I can tell you that. I can tell you that. I'm not, when we all get together to start talking about teeth, I'm always like, guys, come on, let's talk about something else, Yes.
Well, you are on
definitely.
a dental mission trip, so I can't imagine the conversation goes far off from teeth.
Yeah. No, we do. You would be surprised. There's incredible, Dr. Levine, that he runs the whole show. It's, he's the owner of Glow Good, and he's such an inspiring person, and he's like a life coach to me. So yeah, we definitely talk about many more things, well-being and how exercise affects this. I would say to all the dentists, you guys, we all need to work out. We need to do muscle
Better
training,
believe
not
it.
to be like look good, but our backs. I have a lot of back issues, and if it wasn't because I work out, I could not do the amount of hours I do, working.
So
Sandra, we do our stretches in the mission. We do everything.
How did you end up in London?
Good question. So I went to do my specialty in New York at NYU. That's where I met Dr. Levine. He was the head of the aesthetic department. And then, there was a big crisis in Spain, 2008. And they told me, you shouldn't go back to Spain. And I kind of didn't want to anyway. And to be able to stay in the States, I had to study again, right? Because my license is Spanish. And then there was this, not even opportunity. Someone said, why don't you go to London? And I thought, London? I come from an island with good weather. London is like the constant cloud. But I said, okay, I have a friend in the UK that I had lived with in Barcelona. She's a dentist, one of my dearest friends. And she said, come out here and just, try and do a couple of interviews. And I went with no plan whatsoever. That was 16 years ago. So yeah, I knew no one. And then things just went, cosmetic dentistry was, flying out there. So that's how it all started.
Do you think cosmetic dentistry, because there's a lot of dentists, and we've had on cosmetic dentists on the pod before, and it's like, I don't know what the environment is like in London, but at least in North America, everyone calls themselves a family and cosmetic dentist. Like
Really?
everybody. Yeah, there's I don't think one practice I pass by that doesn't say cosmetic and family
Cosmetic
dentistry.
dentistry.
Is that similar to in London?
Not really. We have no, like, I work in a practice. We have all the specialties, Obviously it depends. No, 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 not really. No, it's more general dentists, and then, you want to be more specialized in something. So I don't just do veneers. I see the overall, but I'm the first person that they see, and then I send them to periodontists, implantologists. But it's a work. The thing is, when you design a smile, you're the one that directs everyone else. So it's like, an orchestra where you're directing, and you have to be responsible for everything else. Even though you don't do the implants, or you don't do the perio work or the ortho, but you're the first contact that the patient has. So it all comes back to you.
Yeah.
That's how I like it, because I think when they start a long journey, it's better to have someone that they can relate to all the time, more than all these different people they're going to be seeing. So it's always good that they know who is in charge of their smile from the beginning.
Can you explain to me, and it's different in the UK than it is in North America, but the whole public-private thing, like, is there mandatory time you have to put into the NHS, like into the public health system, before
No,
you go private? No?
no, I've never done NHS.
Okay.
Never.
How
No,
does
I
that
have friends
system
that
work?
just work at the NHS, but I think it's more when you study in the UK, that then you are obliged, I think, to do like a
Okay.
year or so. But other than that, you can go directly to private if you want. Yeah. And the NHS, the issue is that, for example, you're only allowed to do amalgam fillings, right? Mercury fillings.
Oh,
So for me,
Seriously.
being more of an holistic dentist, it's a no-go. Yeah, because that's what the NHS pays for. They pay for the basic stuff, right? A lot of extractions, dentures. So if you want a white filling,
yeah.
composite filling, you have to pay for it. And
Oh,
obviously it's not going to be, it depends on the clinic. Some clinics will spend the money on good brands, others won't. So yeah, that's
So is the
the issue.
NHS higher volume, kind of like higher
Yeah.
turnover dentistry versus private? And private, you still pay completely out of pocket, right? Versus the NHS, you don't pay anything.
Completely. NHS, you don't pay anything. Yeah.
But you can
That's
only
true.
get like a very narrow
Limited
set of.
service. Yeah.
and if you're an
Gotcha.
NHS dentist, do you get paid per patient or per procedure, or just for
Yeah.
working?
How it works, it's so I think it depends on the practice again, but for what I understand, there's a certain amount of points that you have to do per year, which is called UDAs, right? And then each treatment has certain amount of UDAs, and you have to hit the target to get,
Oh,
you'll have a base salary, and then if you do more UDAs, you'll get paid more.
nah, I'm gonna hit my
That's
UDAs
how it works.
and then just go be a tourist in Europe for the rest of the year, man. That sounds
Exactly.
amazing.
Exactly. So each practice is allocated X amount of UDAs, So the higher the UDAs, the higher you get paid. Yeah.
Huh. That's such a unique way of practicing. Like there's some, I don't know how
Yeah.
doctors work there, but there's some place in the world that doctors work on like capitation, or they work on, per patient. So they just get charged, they get, a certain amount of money per year per patient. And then they don't charge,
Really?
for a visit, which is like, there's such interesting ways of practicing because they change the incentives of the provider.
Of
Right.
course.
Yeah.
I think it's in Denmark, if I'm not wrong. I think it's Denmark or Holland that you all have the same price. There's one price for fillings, one price for
Oh,
crown, one
really?
price for cleaning. Yes.
Huh.
You can't change
Really?
prices. Yeah.
Really
I think
interesting.
it's Holland. I should ask, because I have a couple of colleagues there. Yeah.
Holland has a
Which is a
couple of
bit
names,
fascinating.
doesn't it?
Holland.
Like
What's that?
Holland has a couple of names, right? It's like Dutch, Holland, or am I thinking of a different place?
Yeah, you're thinking the same place.
It's like
Same place.
Holland. There's another word for it, right?
Netherlands.
No,
Netherlands. Yeah,
Yeah.
there's like 6 words to describe one country.
I love it. But you know what's universal amongst all of us is stress. And I'm sure that we all
Yeah.
deal with the same shit. And doesn't matter if you're in the UK or if you're in Canada, we all have to deal with it. I think you have a different approach to it. Like, can you explain to us what that is?
I meditate. So I used to do implants and surgery,
Okay.
and I would stress. I mean, I would stress the whole time. So I would come back home and I would have the surgery here, and I'd be like, what if the patient's going to smoke? What if it fails? What if this? What if that? So I found myself like stressed the whole time. And I said, well, I'm too young to be stressed. I don't want this in my life. And then I discovered that meditation, I have a lot of energy as well. So meditation would calm me down. And, it didn't matter whatever happened in my day, I would come back home and that's it. So I would leave the problems of the practice. And I think it's helped me a lot. No, I know it's helped me a lot to like be able to just don't take everyone's problems in, and to just be at peace and calm.
Yeah, I hear
Because
you
at the end of the
because
day, we're not, we don't do open heart surgeries, right?
no,
So,
but yet we
so
internalize our
our
patients'
problems,
problems.
yeah,
Like we
yes, we do,
internalize all
we
of
do,
them. Yeah.
yeah,
And that's
yeah.
the tough part about dentistry. But like, how do you meditate? Is this like a morning thing, a during the day thing, an evening
I
thing?
do
Like, take us
morning.
through
Yeah,
this.
I don't do night meditations. I know they help you sleep, but I don't. I forget. By the time I get to bed, I'm out. But in the morning, I'll do. So I follow Joe Dispenza, Deepak Chopra. I do a lot of visualization. So things I want to achieve, and Joe Dispenza talks about you have to live like they've already happened. So the power of the mind is an incredible thing, and it always works for everything. And I always tell my staff, and you always have to see the glass half full, not empty. And they know me. They're like, you don't have a bad day? I said, yeah, but I leave it outside. I choose to. It's a choice, right? It's a choice. It always is. And we are actors at the end of the day. So when we walk in there, it's imagine, like we do a profession that most of the majority of people hate or they fear. So you have to be at your best every single day. We can't have bad days.
So
And I think that
what's Sandra visualizing when she's shutting her eyes? Like what are those ambitions and those aspirations you're visualizing?
for treatment, it depends. If I'm treating a patient and it was a veneer case, I visualize that everything's going to fit and look beautiful. That's my first thing. I'm like, it's going to work. I see it. It's going in like a glove, each one of them. Because if you start worrying, then things go wrong. I can tell you that. And for life, so many things. Where do I start? But baby
wherever you
steps.
want.
Baby steps. So one of my dental dreams, not life dreams, but would be that everyone has access to dental care, and we shouldn't be doing these dental measures. They shouldn't exist, right? People should have access. And something good that we do here, it's that we continue. So we have people from Boston University coming down several times a year and going to schools and teaching kids. And I think you have to, continue with the work. I used to do a lot of charity in Africa, and you feel great about yourself. You go down there 2 weeks, extract a bunch of teeth, take people out of pain, but then you come back and you're like, okay, but I'm not changing anything for them. I got rid of the problem, but they're going to have another problem, right? Because we haven't educated them. So I think that if every university in the world that teaches, in our case, dentistry, as an obliged subject, you had to get on a mission, and every month you send someone to a place to change a community. That would be one of my biggest dreams, definitely, because it's not something that you do at the end of the day for once a year and to feel good about yourself. It's something that you're actually creating a change. So I think that would be something great that we could do.
I
How about life
totally
ambitions?
hear that, man. That's I think that's what it's all about. But I think, and I've come across the same issue, is providing dentistry is just not sustainable, because there's so much more around it. There's, like you said, there's education, there's nutrition, there's sanitation, there's all these other outliners. But I think everything kind of revolves around having clean water, because if you don't
Yeah.
have clean water, you drink pot, right? Because pop, like you said, everywhere in the world you go, pop will always be cheaper than clean water. And I think that's one of the most disturbing things in the Bahamas where you are. Do people have access to clean water, or is it a continual issue there as well?
Not everyone,
Yeah.
like this morning, one of my colleagues was complaining because the water was cold. There's no hot water, right? And I was saying, wow, we complain, but then there's so many places that don't even have that chance of opening the tap and getting water, right?
Yeah.
So we have to go back a step. When I used to go to Africa, the Coca-Cola in Africa, for example, has much more sugar, right?
Yeah.
Because
And it's cane
it has
sugar
more
too.
calories.
Yeah.
Exactly. So, there was so many rotten teeth, and it's an issue. But yeah, they would share a toothbrush between a whole family if they had a toothbrush.
Yeah.
So yeah, we go back to basic things that we think nowadays doesn't exist, and they do. They
It's
continue to
sad
exist.
because drinking Coke out of a bottle in Africa is almost like a status symbol too, right? And it's
Exactly.
there's so much more history behind the culture and the reasons why like it is what it is, and it's hard to just change the switch overnight. And I don't know about you, but I feel when I go on a mission trip, it's just like working in Canada. No one's going to listen to you when it says brush your teeth and you're like, okay, I'll brush my teeth, but
Yeah.
like they still don't do it, you know what I mean? And I find
No.
I just don't know like what the secret is. Like maybe you guys have the secret sauce down there to help change that area, but I think the fact that you're going back continually and seeing the same patients, I think that's the secret behind it all, because that's how you make the systemic change within the community itself. And I think that's
Yeah.
amazing.
But it hopefully it's going to be twice a year, and then continue to send people, because at the end of the day, we're half an hour, a little bit more away from Miami, a complete different
Oh,
world,
really?
right?
Oh, wow.
Yeah, exactly. So it's like, we have to send people from the universities to
Yeah.
just come down once a month and just teach. And that's the way to change, because when they feel that they don't have, I remember the first year I walked, I came, when I landed at the airport, and there was this girl with a swollen face. And I said, when she smiled, and I was like, oh my God, what's your name? Like, come down to the clinic, And she had a massive infection going on for months, which obviously can take you to septicemia and to eventually, you can die out of something like this. And you release them from that. So then they are conscious of how much their teeth affect the rest of the body. And I think they start changing, and then they look good, they look better, and then they get to smile again. And yeah, it's eyes don't see what the mind doesn't know, right? So when you teach them, then things change, definitely. But again, we have to continue the work.
What did you say
Said to,
what did you say this
sorry,
charity was called again? The organization?
Glow Good. It's Glow Good and Let Love Rule. So Lenny Kravitz, his foundation is Let Love Rule, and the Levine family, that he's a dentist in New York, is Glow Good. And
Let
they both,
Love Rule.
because Lenny's half Bohemian, so that's how everything started. It was his idea.
And how many of you are there?
Well, right now a few, but in each mission we do 2 groups. I'm staying for most of the time, but it's 2 groups, and I think in total probably will be like 80 something, because we have everything.
Wow.
We have maxillofacial surgeons, we have we do prost, endo, everything, the lab technicians, nurses, hygienists,
So
the big team.
Sandra,
And then we have obviously tell me.
I want to flip the script on you here. Okay. Cause I think about this a lot, and I don't want to be negative here. I want to preface this by saying I don't want to be negative. I go on mission trips all the time as well. Okay. However, okay. Do you think that the cost of 80 people, 80 specialists, dentists, just like as yourself, traveling across the world to help this community, do you think if you would have compiled that money, okay, and put it into training 15 local dentists, okay, do you think that would make a bigger change, because then those dentists are there year round? What do you think about that?
Definitely. The problem is that there aren't like
I know.
hygienists. We've done that with
Yeah.
hygienists. So we do have local hygienists now that we know we have a physical place. We used to not have it.
Yeah.
And we transformed one of the churches into the clinic.
I love
So
this.
she goes to the clinic and she like, it's been like baby steps, but we're getting there, right? So the hygienists are from here.
Yeah.
Some of them, and they continue to see patients, but you're absolutely right. You're
Yeah.
absolutely right. That's where the change is, you know. One of the years I did Malawi, and I remember getting down there, and you would walk into, from our side of the world, you hear, oh yeah, donations for a dental chair, right? Or for OPG. Everyone donates, and you, in your mind, you think an OPG is going to Africa and changing everything. They're going to x-ray everyone. Then you get there and you see OPG left there full of dust, and you're like, why are you guys using it? Oh, we ran out of the films.
Really?
And then you go, wow, exactly, because we give them things, but we don't show them how to use them.
That's right.
How to maintain them. So we feel good that we've done our part, but then it's like, no, we have to show these people, we have to educate them how how to use them, how to maintain it. You have to put, certain things, you have to, whatever it is, change the water, the films that, yeah. So then I realized, I said, I think we are the ones that are not doing things the right way.
Yeah.
We have to teach. So yes, you're absolutely
I love your
right.
mentality. I love it because that's what it's all about. It's you can't just like, we feel good when we give, like, man, we'll donate $100,000 of dental equipment, pat ourselves on the back, man, I slept so good that night. But then it goes to waste because you're not helping the people on the other side implement it, right?
Yes.
And you're not
It's called
educating. Ego. Yes.
Yes.
This is what I'm talking about. Sandra,
Yes.
kindred spirits, right here, right here. I love it.
But it's true. And there's a lot in our profession, I guess in every profession, but I see more in ours because it's ours, right?
Yeah.
But there is a lot, unfortunately. Yes. Yeah. But we can change it. I'm positive that we can change it, we can change it. But in the world with Instagram and with all this social media, it's difficult because it's instant gratification and everyone wants to be doing the same thing as good. They want to all be famous, and it's difficult. It's difficult. But the reason I came the first year here, even though I'm friends with Olivia for many, many years, was because I had a crisis and I wanted to give up. And I was like, I'm not happy anymore doing what I'm doing because I'm actually treating vanity. And these people that come in unhappy, they come unhappy with themselves, right? And you think through this smile, you're going to make them happy. And then you realize still they walk away and they're not happy. And I'm like, why am I even doing this? And it's like, oh, this corner, when I do like this, well, don't do that. So I said, there's no purpose in what I do anymore. And when I came down here, I remember that first year, it was a shift. I came with one of my nurses that she's like my sister. And it was a shift for both of us. And we said, wow, we can actually make a change with our hands. How powerful is that? And that's where we should be concentrating, just on that. So then I went back and I saw things a complete different way.
Would you ever change the scope of your current practice to reflect more of, that sort of dentistry, or are you happy continuing to do the aesthetics?
No, completely. Yeah. I would completely. If it was for me, if I didn't have bills to pay, trust me, I would be down in whatever country that needs me working for free, Yeah, I don't have a problem with that.
That's amazing. Well, kudos
I'm not
to
greedy
you.
that way. No, I'm not greedy that way.
Kudos to you. I mean, I don't care what people say. It's like, you give your time and you go down. People say, oh, you could have given money. You go give money. People say, oh, it's easy to write a check. You could have given your time. So, I mean, kudos to you. Anyone that's doing something positive, I think, deserves a pat on the back. And if you're thinking about someone else beyond yourself, I think that's something to applaud. So, I mean, thank you for doing that. And thank you for coming on the show.
But you know what? Like, it's not just coming here. You can do it in your own community. I have friends that, they do other kind of work, and they go every Wednesday, for example, to feed homeless people. They go to a church and just serve breakfast. Like, you don't have to come all the way here or wherever it is to change something. You can change it in your own community because there's always I live in London. In London, there's so much people that need help, all kind of help. So again, you start at home. Start at home, definitely.
So true. So true. Well, we loved having you on the show. Thank you so much for coming on.
Thank you so much, guys.
Looking forward to keeping in touch.
It was a pleasure. Thank you. Of course.